I know what you're thinking. It's been a long time, far too long. I have been working a lot on different things, not just clinical fellowship, hospital stuff. I've just been growing a lot, just as a woman, and wanting to make this video and finally getting to it. This is long overdue. I'm sorry, you all. So here we go. Quick and dirty. I'm going to be talking about how to get a clinical fellowship in the acute care medical setting, because apparently it's really hard. Not just apparently, actually, it is a little challenging to get that placement. So I've got 5 tricks, tips, suggestiones for you to land your dream CF, clinical fellowship, at a hospital. Okay, let's do it. All right. Numero uno. While you are in your grad program, ask for a placement. So request to be placed in a acute care medical setting or somewhere within a hospital. For example, when I was in my first year, I requested to be at a voice center within a hospital. Now, I am very, very persistent when I want something. So as soon as I got into my graduate program, I knew that I wanted to be in a hospital or involved in the medical side of speech pathology. So I let that be known. No one did not know that I wanted to be in the medical setting, because I just let it be known. I ain't scared. This is what I want, so I'm gonna go after it. So I would put that in, and I was persistent and consistent with reminding the powers that I would like to be in a hospital. So I was very persistent with it. But I mean, you may be hearing this and you may be in your second year, and clinical placements have already rolled out. So what do you do? Number 2 is, if a door does not open, if you have missed that opportunity to ask for that clinical placement, you can knock on the window, knock on another door, be persistent, keep knocking, and be creative in finding different ways to get this experience. Because at the end of the day, when you're applying for these jobs, once you've graduated, they just want to see that you've had the experience. And it doesn't always have to be, well, I had a clinical placement from January to May at a hospital. It can be that you were you had clinic at school, but you volunteered or spent a couple of hours shadowing a speech pathologist that is an acute care therapist. I'm pretty sure most hospitals would be open to having a volunteer or a student come in and observe. And I mean, you may not get clinical hours for it, but it's giving you some exposure. And it's a good look. It's a good look. It shows your persistence and it shows your dedication to that cause when you say, well, I didn't get it, but I did this to kind of put myself in that arena. Numero 3. Like I was saying before, if you didn't get the placement, let's say you only have 5 hours volunteering, you can still use some of the experience that you had in other settings that will apply to the patients that you'll see at the hospital. For example, working with patients with aphasia. Granted, that's not the bulk of the patients that I see. Being familiar with, treatments and assessments and evaluations and informal assessments that you'll do with the person who presents with aphasia will be beneficial as you're going through the interview process. I will say the bulk of my patients are dysphagia. Did I say that? Or did I say aphasia? They sound so similar. Dysphagia. So that is top-notch, top priority in the hospital setting. A person comes in, they can't swallow. They come in with aspiration pneumonia. They come in, TBI, all of these things. They first want to know, okay, can we give this patient food safely? And are they going to be able to manage it? And so that's where speech therapy comes in. in whatever setting you're in, if you're able to get some experience dealing with patients or persons with dysphagia, then that can apply to working in the hospital. So say, for instance, you apply to an acute care setting, you're writing all the experience that you have, and you get the interview. They're going to say, okay, what experience do you have in the acute care setting? You could say something like, well, while I've never been in the hospital, I am familiar with dysphagia and instrumentation for assessing dysphagia. Like, I know how to conduct the bedside swallow evaluation. I'm familiar with modified barium swallow studies. I've seen and done research on fiber optic endoscopic swallow studies. So you have that experience, so you're not going in cold because you do have some things that you can bring to the table. Just because you haven't been placed in the hospital doesn't mean that you don't bring anything to the table, because you do, okay? So going back to patients that you see at the hospital, you see a lot of dysphagia, you see dysarthria, a lot of dementia. So cognition is going to be something that you'll want to be familiar with. I mean, the tests that we use are mainly screeners. We don't have enough time to go in depth and really kind of get a full profile of what their deficits are. We're that first line of defense. However, being familiar with things like the CLQT, the Montreal Cognitive Assessment, those are the kind of like those screeners, those preliminary testings that we use to identify if there's a deficit and then move them along to rehab if they qualify. Using experiences that you have in whichever setting, be it at your school clinic or being at like an outpatient facility or a rehab or a SNF, any of those can be used to get you where you want to be. It's just a matter of collecting the things that you have and presenting them in such a way that lets your interviewer know that this is a person who may not have been in this setting, but they have the experience and the equipment that they need to succeed in this setting. Oh yes, numero cuatro, we're almost done. The 3 Ps: be positive, be patient, and be persistent. You'll hear people say, well, CFs don't often get clinical placement in an acute care setting. Case in point, I'm a living testimony of that. So be positive. It can happen for you too. Be patient. It may not happen overnight. God is good. For me, it happened overnight, but God is still good. And for you, it can happen overnight or in a week or in a month. Be patient. When I was applying, there were some places that I never heard back from. There are some places that got back to me, and I was persistent. I was on top of it. I followed up. These are some things that you can learn more about in your career center, about following up, being patient, being persistent, knowing when to send thank you cards or thank you emails to kind of let those employers know that you're invested in this position and you're serious about working in an acute care setting. Yeah. 5. Last one. Be open to change. Be open to move. I saw an opening and I just applied for it. It's hard. I will not tell anyone that this is easy, because it is challenging to move to a new place. But keep in mind that this is your clinical fellowship year. You only get this once. One of my mentors always tells me that this is the last opportunity that you have to be supervised. So if acute care setting is what you want, that's what you're going to do for the next 15, 20, 30 years, then get the experience where you'll be nourished. Get the experience where you want to grow. Just go for it. If that means moving to Arkansas, talk to your family, talk to your loved one, your spouse, talk to your friends. I mean, friends are important, but real friends will understand if you have to move away for a year. Talk to those who are really pivotal in your decision making. Talk to God about it, of course. And, from there, make the decision and be open to change, because it may not come in the place that you want it to come. I will say that it's worth it. This is your career. This is something you're passionate about. If you love science, if you love, dealing with or working with patients, not dealing with, it's not dealing. If you love caring for patients, if you love dysphagia, especially if you love dysphagia, I would recommend getting the experience in acute care setting. So that's all I got. I try to make it short and sweet and dirty, but we're pushing 12 minutes or 11 minutes. But after I snip, edit, it should be under like 8. How you doing? Okay. So yeah, that's how I got my CF in a hospital. So if you are interested in doing so, please apply. Be patient, be persistent, and be positive.